Once again, there are no new cases of COVID-19 to report in New Zealand, our 12th consecutive day with no new cases. So our total number remains at 1,154. We also have some probable cases, so the total combined and probable cases remains also at the same number, 1,504. There is still the one active case, which you're aware of. No one in New Zealand is requiring hospital-level care for COVID-19, and yesterday our laboratories completed 1,262 tests, our grand total now being 283,525. An update on the NZ COVID Tracer app. Now recorded 487,000 registrations. I'd like to continue to encourage as many people as possible to download the app. It will continue to support our contact tracing efforts, including when we move to Alert Level 1. I also want to acknowledge again the work being done by businesses to register for and download the QR code to support people signing in to their businesses. And the latest figure is that there are just over 29,000 posters having been created, representing more than 17,000 businesses and organisations. And to date, people using the app have downloaded the codes just over 496,000 times. And scans are being done each day, and that continues to increase, which I'm very pleased about. And just on businesses, the process for registering for a New Zealand business number and then going through the process of getting a QR code was a slightly lengthy process, so we now have a much quicker workaround. There is a link on the COVID-19 website or on MB website that takes it directly through to another process which is much quicker, and the Ministry of Health will generate a PDF of the QR code and send that out to you. So there are two ways that can be done now, the second, more recent one, being much more expeditious. Just a word on testing. You'll have noticed the numbers of tests have dropped over the long weekend. We've seen this in the past during holiday periods like Easter or long weekends. And as we look at the move potentially from Alert Level 2 to 1, we're also looking at the focus of how our testing will look. And since January, as I said earlier, we've done around 282,000 tests, primarily on people with symptoms. And also on close contacts to rule in or out whether they have infection. Now, as we move from Alert Level 3 to 2, we expanded the testing to include asymptomatic people across New Zealand as part of our efforts to identify if there were any hidden pockets of infection. And over 30,000 such tests were undertaken between the end of April and the end of May, in addition to testing of symptomatic people. And that testing only found one positive result, and that was a worker at Auckland Airport. And it seems probable that infection, this person was asymptomatic, and it seems probable the infection was linked to overseas travel some weeks earlier. So we're at the tail end of that wider asymptomatic testing now, although there are 5 DHBs that have continued that testing over the last week, including the 3 in the Greater Wellington region, Lakes and Bay of Plenty, and then this week Mid-Central District Health Board is finishing off some asymptomatic testing. So the results of that testing are wrapped up and included in our overall public reporting. But over coming weeks, as we move into winter and with the possible move to Alert Level 1, the focus remains very much on testing of people with respiratory symptoms. So I encourage anybody who has respiratory symptoms to seek advice early from Healthline or from your GP or an after-hours clinic on getting a test, and testing is free. There will also continue to be some targeted surveillance testing, and this will be largely focused on the border, but in other places too where indicated. So testing remains a fundamental pillar of our overall elimination strategy, along with our strong border measures and obviously our case isolation and our rapid contact tracing and isolation of any close contacts. Just a reminder though, even though we are in this very favourable position in New Zealand with 12 days of no new cases, there are record numbers of cases being reported globally each day, with around or over 100,000 cases each day. This pandemic continues apace outside of our borders, and we cannot afford to let our guard down. I've had some correspondence from people who have had COVID infections and feel that now that even though they are fully recovered, they are sort of having trouble being accepted as if they are recovered and no longer infectious. And I just want to reiterate that if people are recovered, they have got over the infection, they can go about their daily lives, including attending appointments and going to work and to other places. They are no longer a risk to others. So please do be kind, make them feel part of our society. There is no stigma around having had COVID-19, and we're very fortunate in this country. Of course, we kept our numbers low, and also we had very, very high recovery rates. So I just want to commend to everybody that if you come across people who have had COVID-19 infection, please be inclusive. Just an update on flu vaccination. 1 million doses of flu have now been recorded as having been administered on our National Immunisation Register. That's over 200,000, around 200,000 more than at the same time last season. We've distributed all of our 1.744 million doses of the Southern Hemisphere vaccine and have started to distribute the Northern Hemisphere vaccine that we bought to vaccinate people who may not have yet been able to get the vaccine, and in particular for people who are not publicly funded. And we are very keen to continue to see as many people as possible be vaccinated, particularly those who are at high risk from complications of influenza, that is those over 65, pregnant women, people with pre-existing conditions, and children with chronic health conditions, particularly respiratory conditions. And finally, I was thrilled to see 19 people who work in the health sector formally acknowledged in the Queen's Birthday Honours list, and I'd like to shout out to all those people, many of whom I know, and they're well deserving of the honours they received. I do want to particularly recognise Dr. Karen Patazi, who's been awarded Dame Companion of the New Zealand Order of Merit for services to education and the state. And whilst Dame Karen's honour was bestowed for services to education in the state, she also spent 10 years as Director General of Health in the Ministry of Health between 1995 and 2006, and she continues in health as the current Commissioner at Waikato District Health Board. And in my role, I fully appreciate all those who've gone before, and I'm still in regular contact with Dame Karen in her current role and enjoy working with her very much. And other top honours in health were Distinguished Professor Jane Elizabeth Harding, who was also awarded Dame Companion of the New Zealand Order of Merit for services to neonatology and perinatology, and Professor Robert Bob Elliott, awarded Knight Companion of the New Zealand Order of Merit for services to medical research.